Well, in the valley, there are still no reported cases of the coronavirus, but hospitals are busy preparing just in case.
Channel 5's Monica de Anda spent part of the day learning how one local hospital would treat a patient if they suspected they had COVID-19. She joins us in the newsroom with this exclusive.
Oscar Dina, medical staff at McAllen Medical Center has been going through additional training to adequately treat any person who may be suspected to have the coronavirus. Now, in addition to the training, daily conversations with the CDC are also held to make sure they're ready to respond. According to the World Health Organization, the coronavirus disease was first reported in Wuhan, China in December. And although there's been cases reported in various states around the U.S., including Texas, although here all are people who traveled to affected countries. So far, COVID-19 hasn't made its way to the Rio Grande Valley. But if it did,
one of the first things they're going to do is put the patient in a mask, and we will isolate that patient immediately.
Joanne Shannon with McAllen Medical Center says first the patient would be stabilized if needed, and the health department would be notified immediately.
Those patients would be placed into what we call a negative pressure room, which means the airflow comes into the room, not out.
Shannon also says that many times patients could have mild enough symptoms that would not require to be hospitalized and instead quarantined at home with daily checks from the health department. Those quarantine rooms look similar to this one. Right now, an area inside the hospital is already designated for patients who they suspect have COVID-19 with a capability to house up to 8 patients in a negative pressure room. For safety reasons, we were not allowed inside an actual quarantine room.
We are prepared. We have our masks, we have our gowns, our gloves. We cannot test in-house for COVID-19. We are able to do the testing, but then we work with the health department and CDC for the completion of that testing to be done at a CDC site.
This is reassurance for Valley residents.
It's in multiple states now and many countries, so I think that makes a lot of us panic.
But knowing that hospitals are ready to respond puts Velasquez at ease because he admits his routine has changed.
Wash your hands all the time, whether I'm eating or whatnot, and I go out less. If there's no reason for you to leave your home, then just stay there.
Shannon knows Velasquez isn't the only one who's worried.
A lot of it is still unknown, and that's why people are scared. But primarily what we're seeing in the state of Texas and what we know so far is that all of the confirmed cases in Texas are travel related.
The best thing you can do is go back to the basics. Practice good hygiene and constantly wash your hands with soap and water. Now, as of now, McAllen Medical has not received testing kits from the CDC and have not yet been told when they will receive them, but they do know that they are ready to treat any potential cases. Monica de Anda, Channel 5 News at 6.